Alexis Kliethermes. I'm a first semester nursing student. It's November 18th, 2019 at 11:30, and I'm going to be demonstrating how to do nasotracheal suctioning today. So the first thing I'll do is hand hygiene and check my patient's charts to make sure there's an order for suction by the doctor. Alright. I would go into my patient's room and introduce myself. Hi, I'm Alexis Kliethermes. I'm your nursing student today. Can you tell me your name and date of birth, please? Perfect, thank you. I would then assess for restlessness, gargling, adventitious breathing signs, their mental status, and their skin color, and then their O2 and respirations, and then their pulse. I would go ahead, I already have all my supplies set up, so then I could go ahead and turn my suctioning on. I would turn it on to continuous from 80 to 120. I would go ahead and apply the towel, which we already have it on. I would ask my patient if they were aware of any allergies, and then I would go ahead and raise the bed up to a working condition. We'll go ahead and do hand hygiene again. And I will apply clean gloves to test the suction. Cannot talk. We're going to go ahead and suction you today, okay? Ordered by your doctor. Go ahead and test it to make sure it's working right, which it is. So I could go ahead and put that back underneath there. We'll go ahead and discard these. Hand hygiene. And now I'm going to go ahead and open my pack and get the container out where I will put my normal saline. We'll go ahead and pour normal saline in. I can perform hand hygiene. And then we'll go ahead and move that to the bed. I could just set that right there. And I will go ahead and open it before I put my sterile gloves on. I'm good to go ahead and put my sterile gloves on now. I will perform hand hygiene. Okay. I will deal with that until make some way. Now that both of my hands are sterile, I could go ahead and readjust my fingers. Alright, now I will go ahead and open my tubing. force in my hand. I could go ahead and measure now, which I would measure from the tip of the nose to the earlobe to the base of the neck. And so I will go ahead and measure that now. Okay. Keeping in mind where, how much I'm measuring, and then that will tell me how much I will need to insert without touching the patient, because that will break sterility. Okay. Turn it where I can see the numbers. Squirrel it in my hand just a little. So I know when I'm inserting it to go all the way to 21. Go ahead and recoil. Now I can go ahead and hook this up to the suctioning that I've measured, which I will do so now. So now my non-dominant hand will no longer be sterile once I touch the suctioning. I could get this. Okay, there we go. So this hand is no longer going to become sterile. I'm going to touch it. I'm going to attach it, maintaining my 1-inch border. I could go ahead and pull it up, make sure it's in there. And at this time, I'm going to go ahead and take the oxygen off, making sure I pre-oxygenated or over-oxygenated my patient before doing this procedure. We'll go ahead and remove this. But before I take the oxygen off, I'm gonna pre-lube it. And since this hand is not sterile, I'm gonna go ahead and fix it over here because it's getting a little attached to things. Not dropping below my waist. So now I can go ahead and put it in the saline. And while I'm doing this in the saline, I'm going to apply on and off in this. Make sure it's working. Perfect. Now I can go ahead and remove the oxygen. Alright, Miss Smith, we're going to go ahead and get started, okay? Just going to remove your oxygen. Remembering what mark I measured it at. I'm going to go in. I'm going to have them tilt their neck all the way back. Can you tilt your neck back for me, please? Perfect. I'm just going to help you just a little. She's in a semi-Fowler's position. Or high Fowler's position. My bad. Sorry. I'm going to go ahead and insert it. If you're in any pain or discomfort, I'm just going to have you raise that right arm for me, okay? Alright, I'm all the way in, and I'm going to twist it while I'm taking it out to make sure I'm getting it, and I will apply on and off on this. So I'm all the way in at my 21 mark that I got when I was measuring, so I'm going to go ahead and pull it on a circular motion. Okay, I'm going to go ahead and wrap this up and discard of it. Or before I discard that, I will put it in the saline. Alright, now that I've done that, I could go ahead and discard of this. My hands will no longer become sterile once I do this, so I'm going to go ahead and detach them. Put this back. Once again, my hands are no longer sterile, so it will not matter if I drop below my waist. We'll go ahead and discard of those. Hand hygiene. I'm going to go ahead and put our oxygen back on. go. I'm going to go ahead and clean up my mess. I will lower the bed and we'll get this towel out of her way. Is there anything else I could get you? No? Perfect. I'm going to do hand hygiene one more time, and then I'll go outside the room and document how the patient took the procedure and the amount, the color, the consistency, and the odor of what I got from suctioning, and which nostril I suctioned and how long I suctioned. And if I needed to suction again, I would only suction for 15 seconds on each nostril. So now that I have documented it, I would also document any relevant data that the nurses and doctors may need, and that completes it.